Hey guys, it's Dr. Childs here, and today I want to talk about how long, well, rather I want to answer the question, how long does it take thyroid medication to work? So the quick answer is that most people will notice a difference after starting thyroid medication within 4 to 6 weeks. They'll notice some difference within that time period. I would say, based off of my experience, about 60% of people fall into that category. Then there's about 20% who will notice improvement even faster, and then there's about 20% which will take even longer than that 4 to 6 weeks to notice any effects. So what I want to do now, though, is talk a little bit about the nuances and why it changes from person to person. So let's jump into that topic. So first of all, you need to understand that thyroid medication is different from other medications out there. So it should not be considered in the same class as medications such as blood pressure medications or cholesterol medications. These, because thyroid medication is different and unique in that it is a hormone. Now, doctors, they use hormones for prescriptions, but they're an uncommon medication. Like, even though they're technically all under the same umbrella term, medications are different than hormones. So thyroid medication, don't let the name confuse you. It really is just a hormone. And hormones work differently from other medications. So traditionally, when you consume a medication, you take it by mouth usually by mouth. It can go in other routes, but you take it by mouth. It gets absorbed into your system, into your bloodstream, and then it goes through your bloodstream to where it needs to go, and then it impacts the cell, and then boom, there's some effect. So that could be for blood pressure or whatever. But hormones are different. They go through that whole cycle and process that I just mentioned. However, instead of getting to the cell and activating something right away, what they do is especially thyroid hormone, it activates and changes your genetics and your DNA just a little bit. And so, as you can imagine, it takes a little bit of time for that to kick in. That's not quite as immediate as, let's say, altering a pump or a channel that's on the outside of the cell membrane. Those type of medications impact your body, and you'll see the effects within an hour or two of administration. But that's not how thyroid hormone works. So it has to go into your body and alter your genes a little bit through genetic transcription, and that just takes some time. Now, there are other things that can impact that, though. So this is why. So traditionally, let's say you get diagnosed with hypothyroidism and your doctor gives you 100 micrograms of T4. Then yeah, it might take 4 to 6 weeks for you to notice that effect. However, what if your doctor gave you 25 micrograms of T4? What if he started you out on a smaller dose? Well, then obviously you're not going to feel the effects as quickly as you would otherwise if the dose was higher. So if you just take 25 micrograms and you take it for 4 to 6 weeks, then it doesn't matter. I mean, you might end up taking that dose for 3 months and you'll never feel any difference. It's not because the medication is wrong, it's because your dose is wrong. So one of the number one reasons that one of the number one reasons which impacts how quickly you will feel the effects of thyroid medication is your starting dose. So generally, the higher your starting dose is, the quicker you will feel those. You'll start to feel better, and you'll feel those effects. Those effects such as your hair loss may reduce, your energy may go up, your brain fog may dissipate. You may start losing weight, although probably not. But these are the things that might happen to you if your dose is higher. But there's one problem with that. If I give you, let's say you come in and you have hypothyroidism, and I give you 100 micrograms, which is what I suspect that you will need, there's a high risk that you may have some side effects because we've given you so much so quickly. It doesn't mean that that 100 microgram dose is too much for you, but what it does mean is that generally you need to get there slowly, because you need to adjust to the new way that the hormone is being released into your body. Because remember, normally your body is releasing a little bit of thyroid hormone as it needs it. But when we give it to you by mouth as a medication, you're taking the whole dose for the day in a couple minutes, right? Boom, you're just swallowing it and it's going in your body. So it's flushing your system with all of this thyroid hormone, and it's different from the way that your body produces it naturally. So we have to be careful about how much we give you, which is why most doctors start with a much lower dose. So if they want to ultimately get you to 100 micrograms, they're probably going to start you off at 25 or 50, and then they'll go up every couple of weeks. But just realize that this method of titration can impact how quickly you start to feel better. So that's number one. Number two, what type of thyroid medication are you taking? So the vast majority of people listening to this, and the vast majority of people taking thyroid medication, take a T4 only thyroid medication, which is usually called levothyroxine or Synthroid. They contain only the hormone T4. And this takes a lot longer for your body to utilize than do other thyroid medications which contain T3. So remember, T3 is the active thyroid hormone. So medications which like liothyronine or Cytomel, which contain T3, usually work way faster than medications which contain T4 only, such as Synthroid or levothyroxine. And so I've seen, and this is generally what I do when I'm treating patients, is I started them off on a combination of usually T4 plus T3 at a low dose. That way they get the benefits of using the T3 and they start to feel better quickly. But the T4 is sort of like the long and sustained thyroid hormone that needs to be in the background. But it doesn't do really good for quickly enhancing and impacting your symptoms, whereas T3 does. Again, one of the downsides of using T3 is that T3, because it's the most active medication, it's harder to get the dose right. It's not a bad thing, don't get me wrong, it's not bad to use, but it's a little more difficult to get the dose right initially, so it's safer to start out lower and then titrate up, just like we were talking about with the T4. But just realize, generally, if you start with T3, you'll probably notice results and improvements in your symptoms on 2 to 4 weeks instead of 4 to 6 weeks. And then, of course, the last one, number 3, which impacts how quickly your thyroid medication will work, is your lifestyle. And the question I ask here is your lifestyle healthy? And the reason I need to bring this up is because it doesn't matter how much thyroid medication you take if you're taking T3. If you jump to your dose that you need, your starting dose, and that's 100 micrograms or whatever, if you're not eating healthy, if you're sleeping 4 hours a night, if you're not exercising, if you're stressed out of your mind, there is no amount of medication which will fix those problems. Okay, so if you are still experiencing your symptoms, then and you're taking thyroid medication, you're wondering when it will work. Look to those problems first, because it's not going to help you any if you don't address those problems, and that should be obvious, right? No amount of caffeine that you take or coffee is going to help you get through the day the same as if you got an 8-hour sleep, 8 hours of rest at night. Your body is it's meant to function with all of those things intact, and it does so much better when you're addressing those things. So consider these things. My next video, I'm going to talk about some other things, because we're just barely touching the surface here of things that impact your medication and how quickly you should feel better. So what I'm going to do is I'm going to talk about some other things in the next video and talk about things which may lengthen or the amount of time it takes for thyroid medication to function in your body. But just having gone over these 3, if you have any questions, leave them below and let me know. Otherwise, most of you, about 60% or 6 out of 10 people, can expect that you will see some improvement within 4 to 6 weeks. Maybe perhaps you're one of the unlucky few, which is 1 in 5, which may take 6 to 8 weeks or 12 weeks or longer. Just depends if your dose is right and all these other factors. So if you have any questions, if you've been struggling with getting your dose or how to take it or anything like that, let me know and I'll do my best to answer those questions below. Otherwise, I will see you guys in the next one.